Hello, I'm Dr. Davis. Welcome to our emergency room. It says here that little Stephen has had 2 months of fever, cough, and runny nose.
Yes. And it's Stephen.
I'm so sorry, so tell me more about what has been going on with Stephen.
Well, 2 months ago he had gas. I came here, and they said nothing was wrong with him, but I knew there was something wrong. A few days later he coughed and sneezed. He felt real warm. There was green mucus coming out of his nose. I wiped it with tissue and that helped for just a little, while 2 weeks later he had gas again. Now he has had fever and a runny nose again for the past 2 days. Something is wrong, and I really want to get to the bottom of this.
Has he been to his doctor for this?
No. His doctor's office is really far away.
I see. Who is his doctor?
Dr. Smith, where we used to live in North Carolina.
Oh, so you recently moved to the area?
That's right, about 2 years ago.
Would you like me to give you the phone numbers of some excellent pediatricians in the area who accept your Medicaid insurance?
Sure, yeah, whatever.
Let me guess, it's easier and just as free to come to the emergency room.
Excuse me? I'm sorry, I missed the question.
Never mind. How high was his fever at home?
I would say probably 102.6.
You would say probably? Did you measure it?
No.
Right now he does not seem to have a fever, as his temperature is 98.8.
For him that is high. He normally runs about 93.
So he is a vampire.
What? I'm sorry, I missed the question.
Never mind. Is he complaining about his ears?
Stephen, do your ears hurt, honey? No. Are you sure? Don't lie to the doctor, she is here to help you. Doesn't it hurt even a little? I guess no, you rake. But I have to say that Stephen has incredible pain tolerance. Once, he fell off of his bike and landed on his head. He wasn't even wearing a helmet. He just laid there and rested for a minute with his eyes closed. Didn't make a peep.
Any vomiting or diarrhea?
Yes, vomiting.
How many times has he thrown up today?
None today, but he threw up once last week, when I made him eat my meatloaf.
How is his appetite?
Not good. He normally eats 3 bags of Doritos, today he only had 2.
Has he been drinking fluids and peeing well?
Yes, I have been forcing him to drink his Mountain Dew. He has been peeing good.
Outside of the issues from the past 2 months, is he normally healthy?
No, not really. He gets sick 3 or 4 times a year.
Has he had any serious illnesses?
Yes, he had hoof and mouth disease 3 months ago. I told all my friends and relatives about it, and they were shocked. I received a lot of attention. One of my relatives said I should have the school investigate the case, because we are very clean and there must have been some other dirty kid who gave it to him.
Do you mean hand, foot, and mouth disease?
Yeah, that's it. He's lucky to be alive.
As are the other 3 billion of us who lived through that.
Excuse me? I missed the question.
Never mind. Does anybody in the home smoke?
Yes, but never around him.
Then why does this room smell like an ashtray?
Excuse me? I missed your question.
Never mind.
Listen. I'm getting tired of all these questions. I already explained everything to the guy in registration. You need to do something about this. He is really lethargic. Stephen, get out of my purse. Stop running off with my cigarettes, you little brat. And give me back my iPhone 4. You're going to get a whooping when we get home.
All right, I am going to start the examination now.
Kids, the doctor is going to examine you now.
I'm sorry, did you say kids? I only saw one chart with the last name Johnson.
Yeah, I brought all 4 of my children in to be seen. Stephen Johnson, Devin Lambert, Aiden Jordan, and Skylar Lopez.
Let me go and get the other charts. Okay, Mrs. Weiss, I have examined your children and I believe that they all have viral illnesses.
So you are saying there is nothing wrong?
No, I am saying that they have a type of illness caused by a virus.
So there is no infection?
Viruses are a type of infection. Unfortunately, we do not have medicines to give for most of them.
I want them to get blood work.
I'm not really sure what blood work you would like me to get.
I'm not the doctor, you are.
There is no blood test that will tell me anything about your children's illnesses. But you should be happy that there is nothing dangerous going on with them.
If anything ever happens to my kids, I will sue you.
Yes, I know you would.